Hello, everyone. Welcome to today's webinar, The Next Evolution of Precision Medicine Using Epigenetics to Improve Heart Disease Prevention and Detection. On behalf of Beckers Healthcare, thank you for joining us. Before we begin, I'm going to walk through a few quick housekeeping instructions. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. We will have a series of poll questions during today's webinar. You can submit the answer that best applies to you directly on your screen in the slides box. Thank you in advance for your participation. If at any time you do not see your slides moving or have trouble with the audio, try refreshing your browser. You can also submit any technical questions into the Q&A box. We are here to help. With that, I am pleased to welcome today's discussion moderator, Meesha Dogan, who is also the CEO of Diagnostics. We are also pleased to be joined by Dr. Damon Broyles, Vice President of Clinical Innovation at Mercy Health, and Dr. Adimika Arthur, the Executive Director of Health Tech for Medicaid, who will be our panelists today. Both speakers will briefly introduce themselves before our discussion begins. But right now, Meesha, thank you for being here today. I will now turn the floor over to you.
Well, thank you for that kind introduction. Good morning, everyone. Good afternoon, depending on where you are. Good to have you all. Thank you for taking the time to join us today. We're thrilled to have you. My name is Meesha Dogan. I'm the CEO and co-founder of Diagnostics and will serve as the moderator today. I'm very excited for the discussion today on epigenomics, precision medicine, and the value they can drive across the healthcare ecosystem, and would like to thank our expert panelists for taking the time to share their valuable insights. So as far as our agenda today, we will kick off our webinar today with introductions. We'll cover a few key concepts that you will hear throughout our conversation today. So hopefully those key concepts will help set the stage. We'll spend the vast majority of our time discussing various topics with our panelists. We may jump around during the discussion, but we will keep a close eye on the audience questions so we can tackle them during the Q&A portion of the webinar. Please feel free to add your questions to the chat. Just know that we may not be able to get to all of these questions by the end of the webinar, but we'll make a point to follow up via email afterwards. And at the very end of the webinar, I'll briefly share how our organization thinks about partnering with healthcare stakeholders to operationalize these ideas and transform or build new cardiovascular initiatives. So with that, our first panelist today is Dr. Damon Broyles. Damon is the VP of Clinical Innovation and the Director of Precision Medicine at Mercy. Thank you for joining us today, Damon. I'd love for you to briefly introduce yourself.
Oh, it's a pleasure to join you, Meesha and Adimika. Thank you for the opportunity to talk on such interesting topics. So I've been with Mercy in the position of VP Clinical Innovation for about 6 years. Prior to that, I served as the Chief Medical Informatics Officer at St. Anthony's, which became Mercy South in an acquisition. So over the past year, as we've stood up the Mercy Center for Precision Medicine, I've also had the good fortune of being involved with a number of very bright people as we work to get that off the ground.
Wonderful. Thank you for that. Our second panelist today is Adimika Arthur, the Executive Director of Health Tech for Medicaid. Thank you for joining us, Adimika. I'd love for you to introduce yourself as well.
Sure. My name is Adimika Arthur. I'm an epidemiologist by training, and I ran hospitals for about 15 years before starting Health Tech for Medicaid. Health Tech for Medicaid is a nonprofit organization really centered as a convening body, bringing together the ecosystem, right? Payers, providers, policymakers, entrepreneurs, investors, advocates, but most importantly, the 87.5 million individuals on Medicaid They're caregivers that ultimately make up most of our community. Over a fourth of Americans are on the Medicaid programs, the largest insured population in this country. And as we talk about health technology, we've often not thought about what we call equitable and inclusive design techniques to really include most of our community as a part of those conversations. So that's a little bit of our anchoring. Our goal is really to have quality access and equitable care for everyone, which is more of an equality metric than an equity metric, but we do that by kind of combining health equity and tech equity together.
Wonderful. Thank you for that. Thank you to both of our panelists for joining us. As mentioned previously, I am the CEO of Diagnostics. I'm also the co-founder of the company. Diagnostics is a precision cardiovascular diagnostics company, and we develop clinical tests at the intersection of three key areas: epigenetics, genetics, and artificial intelligence. And we focus on the prevention, early detection, and in assisting in the treatment of cardiovascular disease, which we know is the #1 killer. By way of training, I did my doctorate in biomedical engineering. I started my work in the world of epigenetics over 15 years ago, when epigenetics was not even as widely studied, and coupled that to artificial intelligence over 12 years ago. And as a result, co-invented the technology behind Cardiodiagnostics precision clinical tests. I also do come from a family with 2 generations history of heart disease, heart attacks specifically. So precision medicine leveraging epigenetics for cardiovascular disease is a topic very, very close to my heart. So I'm excited for us to be here today and have this conversation. As I mentioned early on during the agenda, the goal is to go through a few key concepts before we dive into the discussion. I'd like to set the stage with these 3 concepts. Now, looking at epigenetics, I usually contrast that to genetics and saying, if we think of our genetics as our DNA hardware that is static, that we inherit from our parents, it's a nice way to look on the other side and contrast it to epigenetics and think of it as our DNA software that is dynamic, which is influenced by our lifestyle and environment, among other factors. Precision medicine is leveraging these advanced science and technologies, such as genomics, epigenomics, to help us assess and tailor what an individual or what a patient needs on a more personalized level. It could be a diagnostic test, it could be a treatment plan. And as I mentioned, cardiovascular disease is the #1 killer globally. And what studies have shown that only about 20% of our risk for heart disease comes from our genetics. The vast majority of our risk actually comes from non-genetic factors, including our lifestyle and environment, which is why we went into the world of epigenetics, because it does capture a large portion of vulnerability to cardiovascular disease. That being said, I wanted to cover a few key data points before we get into the core discussion. The American Heart Association projects that by 2035, nearly 45% of Americans will have some form of cardiovascular disease. And the majority of the deaths associated with cardiovascular disease is actually from coronary heart disease. Coronary heart disease is the major cause of heart attacks and is a large contributor to heart failure. So with that, I'm excited to have our discussion with our panelists today, Damon and Adimika. Kicking off with the first part of the discussion, we know healthcare innovation is increasingly at the forefront, and many are looking to enter into or continue to participate or accelerate this area in their organization. I'd love for you to share your journey. What inspired you to pursue a career in healthcare innovation, and how did you get your start in this field? Damon, should we start with you?
Certainly, thank you. So I'm a family medicine physician by initial training, and really entered into innovation through an informatics path. So I've got started in more of an ad hoc capacity as a young family physician, working on the nascent EMRs that were going into place in the organization. And that led to increasing more formalized roles over time through the routes that you would imagine, becoming familiarized with the technology and then getting into the areas of clinician education and optimization, enhancements of the EHR. And what I realized with health technology is that it gave a fantastic ability to have a generalist approach to a health system and physician organization and a hospital. And that large lens was really familiar from a family medicine standpoint. So there's a lot of parallels between informatics and primary care. It also allowed a tremendous amount of creativity to be expressed, and more so than just in the practice of medicine as a solo practitioner per se, and realized very quickly that was gratifying, super enjoyable, and something that I wanted to get further and further involved in. So we've been very lucky that we've had some visionary leaders in the St. Louis area who've developed an innovation ecosystem. They've been very purposeful and deliberate about how those pieces of an innovation puzzle fit together. And so the opportunities in St. Louis to participate alongside those innovation leaders became easier from a barriers of entry standpoint. So moved into that space as well because it was available and there was an opportunity to use that generalist lens to help new startups and entrepreneurs who didn't know a tremendous amount about the opacity and the monolithic nature of healthcare in America better understand how to get to the places where they were needing to get to while they tried to solve those really wicked large scale problems. All of the things that you had mentioned in the starting slides are on the scale and the scope of a problem like coronary artery disease. That is the type of ability to impact things when you're coming in with an innovation and an informatics lens that I most enjoy in these spaces.
Wonderful. Adimika?
Yeah, I think my path is a bit circuitous. One, I live in the Bay Area, so I will just couch this conversation with, I live 16 miles from Silicon Valley. But my interest in innovation really came by way of being a hospital leader. I was a part of the foundational team of the state of California that expanded Medicaid in the state of California in 2005. And that is actually the move that allowed me to become a hospital leader. So I got to learn how to be a hospital leader under the great leadership and example of Wright Lassiter III, who ran the Alameda County Medical Center at the time. I then went on to work at UCSF and then subsequently Sutter Health. And I would say that, one of the biggest things as a hospital leader from an operations perspective was getting an EHR up and running. This is really back in the, kind of mid 2000s. And so really, I will say I was a bit naive. I thought that all that really health technology was really computer-based, SaaS-based electronic health records, which, to be fair, as a hospital leader, was a lot of work for me, right? Like it was not necessarily something that we found was helpful. And I mean, obviously we needed to move towards having electronic records versus paper records, but it wasn't necessarily optimizing my workflow or making lives better in the inside the four walls of the system at the time. But I think I became very curious. I would often have people who are entrepreneurs who wanted to meet with me, and there was a real disconnect between, the app they were trying to sell me and what my challenges were as a hospital leader. And I think that by the time 2010 hit, real interest in what is this? What are they doing? Right? What is this field that's been developed? And so I think I started as an angel investor, really trying to understand what is this field? Who's funding it? Where is it coming from? Listening to pitches where I am not an entrepreneur, but understanding the life cycle of how clinics and the hospital system worked and patient flows. I really was interested in where do we marry these? And my real interest kind of started in looking at the next wave of innovation in hospital leaders. That really sparked the beginning of what started Health Tech for Medicaid, which is when I realized that we had a pattern matching system. We had created this entire field that many of us in healthcare didn't know a lot about, but we may not have thought about all of the people who actually need help. So to me, health technology needed to be something with a Hippocratic belt around it, right? With some standards, competencies, skills that that allowed us to create products, services, delivery systems that served everyone that I saw in our hospital systems. And so I think that was the interest in really understanding that there may have been a disconnect between many of the, the venture partners and the entrepreneurs who were creating things, right? And what is a good customer base, right? And so oftentimes in the very beginning of health technology, that customer base was people with discretionary income or commercial insured populations. And, it's been a wild ride in the last 5 years to really watch us really start to think about how we can actually do more inclusive and equitable products, services, delivery systems, but also influence our capital markets and really effectively change our narrative around who gets access to technology, who are we actually building this technology for, and how we can all benefit, all of our quality and duration of life benefit from these products.
I think if there's one thing clear to me from both of your responses is that innovation doesn't happen in isolation. It takes various parties to come together, not just to build something that's innovative, but also to apply it in the right way to make sure that we're seeing it to its fullest potential. So thank you for that. We know one thing about innovation, just thinking back about my experience, right? When I mentioned about my journey, having started in epigenetics 15 years ago, and over 12 years ago, when we were starting to see artificial intelligence sort of peek its head in healthcare, it was all brand new, but 12, 15 years later, here we are, at the forefront of using epigenetics, the forefront of using artificial intelligence. ChatGPT is so exciting if anyone hasn't used ChatGPT, right? And considering how fast we have moved, I'm curious, how do you stay up to date with the emerging technologies in the healthcare industry? Adimika, this time we'll start with you.
Sure. So one, I have the benefit of spending a lot of time at healthcare meetings, right? In all sorts of different frames, right? Because we're a convening body, I get to hear the pain points of my old colleagues, right, who run hospital systems and clinics. I also get to spend my, elbow time with payers who are really thinking about things like redetermination and eligibility. But I also get to spend time on the other side, not only with developers, but also people who are funding. And so I carve out about 30% of my time I spend with entrepreneurs, specifically interested in seeing more of a pipeline of underrepresented founders, first-time founders, founders of color, founders with who come from the LGBTQ population, veterans, individuals with disabilities, whether visible or not. And so because of that, I get access to a lot of what is out there. But I'm also interested in the intersections of where, medical device, like where digital health, like the continuum of digital health kind of moves beyond, right? And you just talked about like med devices are like the changes in our IT systems, how algorithms are looking, AI, blockchain. And I think most of that comes from reading a tremendous amount, webinars like this. I do a lot of work around insights. And then I really like to pay attention on the edges of many meetings and trying to see how we can have discussions. It's a little bit of how I learn, what are our inclusion and exclusion criteria of who we're thinking about being, who's going to benefit from some of these really exciting and emerging concepts.
Damon?
So those are fantastic answers, and I would share a number of the same strategies. I really try to be deliberate about interacting with innovation-minded colleagues taking advantage of symposiums and regularly meeting groups where you have folks that are cultivating their curiosity, really actively having conversations about what might be, what's coming, and then specifically asking them, how do you see this problem being solved in the future? How are you seeing the confluence of technologies that Adimika talked about shaping, what comes next? Definitely spending time with young entrepreneurs who are in the startup realm, because they see those problems differently. They are more aware of emergent solutions. They have new recipes for how they're going to recombine things. They sometimes don't see all of the existing barriers, but that's okay, because frankly, it's just looking for the crystal ball and what's coming, and that gives you a great insight into how the next generation of entrepreneurs is going to solve those really hairy problems. I encourage exploration on our teams. We encourage that curiosity cultivation mindset, and that in turn fosters great interactions on the internal side of the Mercy organization around, hey, did you know that ChatGPT is doing this? As an example, had at least 2 or 3 conversations this morning that were really fascinating, based on other team members reaching out and trying to get a hold of new answers. So, and then heavily curating all of the sources of incoming information to make sure that you are trying to get as broad a intake as possible.
Yeah, that's a great point. I always tell people one of the best parts of being part of cardio, building cardio, leading cardio, is just the fun in being able to continuously learn, both just from digging in, but also meeting peers who have either done this before or paving the way in various areas. So learning is definitely key to continuing to drive innovation. But I think there's one other aspect that I think we would agree that leads to innovation, and that's needing to solve difficult problems that come up time and time again. Multifaceted problems, right? Would be great if we just one problem, one solution, we're done and we're ready to leave. And we're always iterating these solutions. It's never one and done. And so I'm curious, what are some of the biggest challenges that led to the need for innovation within your organization? You touched upon it a little bit, Adimika, but would love to hear, some other thoughts that you may have.
Sure. Let me just say, I'm probably not my organization, but in our ecosystem in general, part of the reason why my organization came to be, and I turned from hospital leader into now social entrepreneur, which is really solving those very large, hairy challenges, is to move the needle, right? 5 years ago, I was there when many folks were just getting their first checks, right? Who were entrepreneurs who were looking at serving the Medicaid population, literally, for the first time, right? And we're still dealing with what is the business case for equity in this country. We are on the heels of a racial reckoning, right? And really looking at determinants of health outside of just the social framework, right? Political, economic, environmental, ecological. One of the things I like to say is pushing the envelope further as we go. And I say to that, like, for entrepreneurs, I ask them often, great, how diverse is your team? Are you actually hiring people on Medicaid to actually be a part of your team? What about your independent board seat, right? Who are you filling that with? How are you changing the needle and the ecosystem and pushing us along? I ask our payers exactly that. What are your multi-tiered products? There is not going to be a one-stop, one size fits all for your patient population or your customer base or your consumers, right? And so I ask, right? I ask venture, really push, who are your LPs and what are their interests? And how is it that you can diversify more entrepreneurs that maybe aren't young and went to Stanford and and had like a complete pattern match, but really or someone with lived experience who actually knows this is a challenge and can actually solve it. We have more clinicians coming in as CEOs and as innovators, which is very exciting. We're looking at fields like public health and areas of the ecosystem that we haven't often thought about. So I would say that's my biggest interest, is really pushing the envelope further. No matter who you are, if you're a health system, how are we integrating these products that we have purchased, right? And not just have our innovation office make those decisions, but how do we include consumers as a part of, or people that are in our community as a part of that decision-making process? So I believe all of us can actually move the needle in making this more of a part of people's lives and a part of our conversations, and that it's not separate, that innovation's not over here and the rest of the work we do is here.
Yeah. Damon, along those lines, I think I'd like to add a dimension. Given our interaction in the past, I'd love to add another dimension to that question. If you wouldn't mind addressing, would be, I'd love to hear about the challenges, but also in the context of a project or a product that was adopted or built to help solve those challenges that you see.
Most certainly. One of the challenges, and it's going to not be unique to Mercy as a health system, but every administrator, operator, clinical leader is going to be familiarized with it. But it's the macro level pressure. So workforce shortages, clinical, vocational exhaustion related to all of the complex system requirements that go into practicing medicine, the cost pressures that are everywhere, and the shift in the payment paradigm. So moving from a fee-for-service to a value-based payment methodology. Those are all things that we really need to be accommodating and using innovation to help solve. Probably one of the most recent and technologically complex and gratifying projects that I've been involved in was something that our chief clinical officer challenged us with, and it was kind of a devilishly simple challenge. And he said, "Hey, we know that there's evidence-based medicine interventions when we're caring for chronic diseases. We're using robotic process automation in a whole bunch of different aspects of the organization. But why aren't we using those same types of strategies here to do things like get an A1C ordered for patients that we know need one and are disengaged from their primary care?" That was a project that, as you start rolling that over in your head, you realize there's technology, there's people, there's process, there's behavioral science, but it was just this great opportunity to work with a extremely talented and very diverse team, because innovation occurs at the margins of knowledge domains and at the intersections there. So it was a massive lift, but at the end of the day, we came away with a system that was acceptable to our clinicians, that gave them line of sight and situational awareness on how we were outreaching to patients, that was digital in nature. It was proactive. We were getting upstream of the known need, so that we weren't asking our clinical staff to, oh, hey, here's another thing that you have to do. We were allowing the patients to schedule the necessary intervention themselves and get it in a way that they were more likely to actually engage and go get, considering they had been heretofore, not doing those types of things that they were being advised to do. In the end, leads to a larger group of patients getting better care in a way that allows our clinical staff to practice at top of license, and to really focus on the trickier aspects of chronic medicine.
That's a great point. One of the things that I've always been fascinated with innovation in healthcare is how much it has led to being able to meet patients where they are, what they need, beyond just the four walls of a hospital or a healthcare provider's office. And to your point, being able to understand who they are, engaging them, getting them in to do, the testing that they need, and being proactive about their health is certainly an exciting use of innovative technologies. But going back to the idea of precision medicine, because one of the key things with precision medicine is when we engage someone, when we bring them into the doctor's office, or when we meet them where they are, we're now able to do medicine much better, more tailored, more personalized for who they are and what they need. And along those lines, with precision medicine, for the longest time, we've learned about genomics. We have leveraged genetic biomarkers in being able to do precision medicine or do precision medicine testing. But that has really evolved. And given that we're also talking about epigenetics and mentioning earlier about how with cardiovascular disease, for instance, only 20% of our risk comes from genetics, it's no longer possible for us to fully understand or address a complex disease by it being a single thing that we're looking at. A multifactorial problem requires a multifaceted solution. Along those lines, I'm curious, how have you seen the definition of precision medicine continue to evolve? And what is your take on the expansion of this definition to now include an area like epigenetics? Damon? Would love to start with you.
Sure. So, I think with the advent of the Human Genome Project, there was a colloquialism around precision medicine that was really more genomics focused. But I think we're understanding as we bring these technologies and these approaches to bear that it's really every aspect of your care journey. So there's an opportunity to be precise and proactive and predictive in all realms of how you're interacting to care for your own health. So, as an example, when we think about social determinants, how much those really impact the response and the outcomes that we're after, there's so much room to be more precise in how we're tailoring needed treatments and needed interventions to our patients on the social front, and where are they running into barriers to medication compliance, or where are they running into barriers to issues of access to the care that they need. So I heard at one point one of the leaders in genomics and precision medicine talk about the reason that they went into that field. And they were using the analogy of the mechanic and the car dealership knowing much more about their customers and the car diagnostics on an individual basis than they were able to get when their loved one was going in for cancer treatment, and that misalignment and that lack of ability to understand and have a precision focused interaction and treatment plan developed was really what led them to go into the field of precision medicine. So I think specifically to epigenetics, that allows for an increasing awareness of the health of a patient, the risks, and the pathogenicity of the endogenous and exogenous factors that have been brought to bear on that particular patient. So it's just that it's adding another highly high fidelity tool to the toolbox that we have, and we're bolting that on in our attempt to get to that really custom tailored treatment plan and prevention plan for our patients. So it kind of is reminiscent of Robert Hooke coming up with the compound lenses and the microscope and being able to look and see, oh gosh, there's something entirely new that we were not appreciating, but that has an enormous bearing on the biology in systems. And that's what this feels like. that there's just this whole additional realm of information that heretofore was just not appreciated, and that smart people like yourself were working to unlock and surface. And now we have this ability to draw new conclusions and practice differently in a way that is much less one size fits all, and much more, this is exactly what you need today, based on this confluence of information.
Wonderful. Adimika, would love your perspective on it and what you're seeing. Would love a take on as well, bringing precision medicine to communities that you were referring to previously, Medicare, Medicaid communities.
Sure. Well, let's start with, I completely agree with what Damon was mentioning. I see this as kind of an emerging lens or an evolution in precision medicine by including and I don't think of it as a bolt-on as much as an integration, right, of precision medicine. But I think we should step back and remember, and I'll just say there's an occupational hazard with being an epidemiologist, because the first place I go is around the data, right? Yeah. And this adjusts or changes our data context and what is precision medicine, right? Where are the sources of data? What is the infrastructure, the security, the data science, right? There's not a lot out there. If you do a lit search right now around epigenetics in certain populations, you're not going to see a lot. You're not even going to see a lot when you put that in with precision medicine. And so what does that mean for data and data sharing? But more importantly, taking that bridge or that crosswalk, as Damon was talking about, what does this mean for being partners in care with communities, with people, with families, with caregivers, and also research, right? And I think there is a need for us to have more patient-centered, person-centered, whole person care, and to have more improved access to data. And how do we have that conversation with communities? How do we have that conversation with people? I'm going to leave the education and workforce pieces to the side, because I think we'll get to that a bit later. But I do think that this means areas around regulatory change that we have to think about. And also, around finance and cost models and reimbursement. I live in that world too. And oftentimes if things are paid for, people will figure out how to do the reverse engineering around how do we provide the adequate education? How do we retrain our existing workforce? How do we provide better patient education and counseling? Because right now, just the bare bones around precision medicine is not necessarily available to all patients, right? And so it's actually not even necessarily understood by all clinicians. And so, I think that's where I would go and think around. I love that there's been some emergence and evolution. And I'm looking forward to the research and our clinical training and our clinical methodologies catching up.
That's a great point. And I think, to your point, there's still learning to do, there's still growing to do, and there's still adopting to do. I'm curious about two things. I just want to make sure there are a few more questions that I have that I think the audience would find very valuable. So trying to think about two pieces. One is, what do you think the implications are if healthcare stakeholders don't really think about shifting their perspective from more traditional approaches to adopting approaches that really gives them the tool, the newer tool, the necessary tool in their toolbox to be able to provide better care. But also on the other hand, what are some best practices for them to go about doing that? Damon, would love to start with you on those areas.
Sure. So I think the easiest part of this question is what happens if they don't, and it's very similar to how folks have kind of referenced AI and machine learning in medicine. It's these are technologies that aren't going to supplant the traditional practice of medicine, but you're going to be supplanted from a healthcare system if you're not embracing and moving into the usage and the understanding of where they fit. And so, but I do think, that said, we have to understand how fast moving and dynamic this technology and this new science is, and make accommodations for that. we saw during the pandemic that it's very difficult for the human brain to understand exponential growth. And unfortunately, that became very clear there, but that hasn't changed. And exponential growth in knowledge is what's occurring right now. And the enablement of new insights from existing insights, it's kind of a straight line up. And so how do you incorporate that type of a dynamic into the practice of medicine? I think you really have to acknowledge that it's daunting for your clinical stakeholders on two fronts. Number one, just the science itself. That how do I get to a place where I understand what's going on here when there's so much out there to get my head around? But also, and I think just as important, is how do I bring this into my existing system? So that is daunting. How do I use this type of information, even if I'm on board with it? And so that's the work that we have done in our precision medicine, standing that up, is really trying to accommodate that aspect as well, and making things as straightforward and as streamlined and as frictionless as possible for both our clinical staff and our patients, so that we can democratize these technologies and not be at a place where, hey, some docs are using it, some aren't, some patients in some regions have it available to them, others don't. And getting rid of that heterogeneity in the adoption curve, and putting in place systems that foster more universal and widespread use where it's applicable has been really helpful.
Adimika, your organization, you've been a central part of convening healthcare stakeholders. I can't wait to hear. Damon has shared so many great points. I think there's more to come, so I'd love your perspective on it, please.
Sure. I love Damon's anchoring about the pandemic. I'm going to give a different frame, which is that we also, by force of conditions, we learned how to adopt. We learned how to adopt telehealth in a rapid cycle, way faster than they ever anticipated we would. And I think in some cases, when I think a little bit about the key issues that we have to think about as it pertains to precision medicine, it really is, how are we going to integrate social and environmental factors into this new definition, right? This larger ecosystem of what precision medicine is. How are we going to seek value? I mean, the reality is that's when you're going to get the attention of payers and hospital leadership and large academic centers and policymakers, right? If we start showing value in these strategies, that's going to help. I think the word evidence, right? We've been talking about clinical evidence for hundreds of years, right? But we need to acknowledge that evidence is evolutionary, right? And it's becoming more complex. And what does that mean for us? And I think I can't do this without saying that we need to anchor on our disparities in this country, and that this is a potential way for us to learn more and to actually see how this can help our economies, right? This can actually help. I always say, like, health is the largest economic indicator. If we are healthy, we can contribute to society. So when I look at themes or larger things that we should consider, one of them would be like our investments in precision medicine. What does that look like? More evolved strategic thinking about what this means for us across the ecosystem, and really honing in on what are some broad disease areas like cardiovascular disease, right? Where we want to begin to really dive deeper, right? And see how we can actually transformationally change health delivery and outcomes through precision medicine itself.
I would say building in the void of data is a recipe for disaster, and hopefully we'll continue to stay away from that as much as possible and continue to use the data to lead what we're building and how we're applying and the challenges that we are addressing. But one of the things that we know about is, both of you have brought up about the dollars and cents, right? Like, the payment needs to make sense. And I'm curious, how do we encourage payers to embrace innovation in their payment models so that cost of precision medicine technologies is not a barrier to improving outcomes? Adimika, would love to start with you.
Sure. I mean, this is a sticky and tricky area, right? Because our healthcare system, I don't want to say it's fully broken, but it's got a lot of cracks and fissures, right? And in order to secure kind of the full benefits of what precision medicine is, including epigenomics and others, we've got to have kind of full and fair reimbursement for new technologies, products, services, and they actually need to be made available to the people, right? Oftentimes we, and payers are on the hook for this a lot, right? We try it out with individuals with discretionary income, with the ability to pay out of pocket. And that anchoring doesn't really say much about helping us with the benefits of personalized medicine. I think that really to kind of monitor and evaluate and contribute to the anchorings of the field, we need to think about including everyone as a part of that process. And I know that's hard to say, and I'm not saying that from the perspective of, I just don't think we can continue to keep innovation. I think it's a crime, actually. I don't think we can keep innovation away from individuals because of their non-ability to pay. And I say that because, even something like Medicaid, it's a $950 billion industry. That is a very big customer. And so I think we have to think about creative and novel ways in which we make sure that we're getting the full value of precision medicine, because it's not great if we're only looking at a very small slice of the population and a very small slice of folks who may be able to have the discretion to participate.
So I love, and earlier, Adimika, you had mentioned, making the financial case for equity of outcomes. And I think that the more that we can focus on those sorts of things, the faster we'll move to the point of this question. But being creative around the ways that you're developing data can be very helpful. So, as an example, thinking about food as medicine programs, looking at, what are the outcomes that matter to the financial bottom line that make this a sustaining virtuous cycle, rather than maybe some short-term outcomes only that make us feel good, but don't address that financial aspect. Because I think you're exactly right, that the healthier a society is, the more robust it is, the more vigorous it is, the more economic good there is in general. And so, that's one way to go about this. But this is a tough question. And for even as we accelerate into the value-based environment, it is really a challenge sometimes to look out 5 years and 10 years in the future and say, well, here's the expected decrease in utilization. Here's the expected decrease in spend. I think you're needing to leverage your data science folks. You're needing to be innovative in how you present those ROIs. Using real world data, looking at the costs to a patient population thus far, and really getting into the mattresses as far as all the resources that you can bring to bear to do that encouragement and to show, at the level that needs to be, where it's granular enough to payers, hey, this is what this is going to enable. And this is how, the tide is going to rise and everyone's boat's going to be higher. We also, benefit from closer relationships with payers. As we do more and more of the data sharing and the value-based environment, we do have this offshoot of having more collaborative relationships. That builds trust. It makes it easier to have those conversations, even though the content that we're going after is difficult to prove out. But we also can't forget to emphasize the costs of the status quo. So when you quantify things, it's very easy to forget to quantify the cost of inaction. And those things are, they can be out there, and for all intents and purposes, they sort of look like the cost of doing business that everybody's been, accommodating and complacent about. But if you critically analyze that, it can be something that gets you off center pretty quickly. And so, highlighting how these new technologies, democratize good outcomes is not an easy thing to do, but a necessary one.
Yeah, and I just want to say two things. I think that one is really around how do we harness for public good, and to not forget that we have to, we also need to make sure that we're preventing ourselves from unintended consequences. And the only way you can do that is partnership. And I think a big reason why we believe in convening, right? Bring disparate stakeholders together allows for us to look at agile governance and have conversations that are uncomfortable to have. But once you start to have them, then you really know what are the problems that we need to solve and what are some ways in which we can tackle them. But without having those conversations, we can do harm.
That's absolutely so true. For us, as a company, we've always been fortunate to continue to have that conversation, because it's never black and white, whether it's an innovation or how you apply it or the parameters you think about. I wish it was that simple. I'm sure we all wish it was that simple. But it's a complex problem and a complex relationship, or sets of relationships that we're going to have to continue to navigate. And I think one of the points that we've talked about that I'd love to explore a little more is the part about equity, and making sure that all of us, regardless of who we are, where we live, what we do, we all have access to the best possible care, the best possible technology, evidence-based technologies that we know are going to help improve outcomes. Along those lines, how can healthcare stakeholders work together to ensure that epigenomics and precision medicine are used effectively and equitably across diverse patient populations? Adimika, we'll start with you.
Okay. I think that we have a pacing problem, and always have, with technology, right? Sometimes the tech is, significantly ahead of where our laws and regulations are, and our laws and regulations tend to actually create policies that help us with reimbursement. So it's like a pace and timing issue. I would say a combination of kind of our technological, ethical, and regulatory challenges has really limited the impact of precision medicine. We have put it in this very small box, and I think we illustrated today, and you've talked a lot about how that box really needs to be opened and include other things in the evolution of what we're seeing in the field, right? I think a way to overcome that is really looking at where are our investments in healthcare innovation. Mm-hmm. And I think this goes back to a little bit of what Damon was saying, and balancing the risk of not investing in learning more and bringing everyone along with us. And where we're wasting money, right? Waste, fraud, and abuse, because we haven't dug in. And then I think in some ways, this is where a global push is really helpful. And maybe this isn't something you want to hear. But I think that globally, seeing other governments work with industry, build on best practices, create competencies, and collaboration really will push the US along too. And I think we are seeing leaders that are looking at ethically accelerating innovation that I think will provide a little bit more gas in our tank. Because when you look at the precision medicine pipeline, right? Moving from research through development, to treating people in the hospitals, to communities talking about it in the fields and the factories and in the community centers, we have not progressed as far along that continuum as we need to.
Damon would love your perspective.
Yeah, those are fantastic points. And I'd only add, I think it's helpful to be conscientious and honest about our past failings, and use that as an animating force. It really creates an evocative framework when you can point to the array of reasons that we're not where we should be, and where we know for a lot of us where our mission statement of our organizations demands that we should be, and use that as the acknowledgement and the MO for doing all of the hard work to make this statement and the question here a reality. Something that I think is interesting that's related to cardiovascular health, and that maybe exemplifies this, is the idea that we've all internalized this idea of an executive physical, right? And so, like, in that just description itself, there's an implied differentiation between care that one group might get and care that everybody should get. And so these technologies really have the promise of making that type of a differentiation in care and care outcomes something that we can look at historically, but it doesn't represent the current state of the practice of medicine.
Yeah, and I think that societal benefit piece, but also remembering that everyone should have access to improving life-saving treatments.
Yeah. Absolutely. And I think if COVID taught us something, it was the direction that we were heading, but it accelerated in the sense that healthcare is no longer as centralized as it used to be. And now we have nodes. We are more creative in the way we provide care, but also in the ways we engage patients and get them involved more so in their care and their health, and bring community organizations together to be part of those discussions as well, to ensure that innovative technologies that we're building is not just for select few groups. It's something that we can think about and work towards making available broadly for everyone. I know we're coming up on time. I know we can talk about this topic for much, much longer, but I want to be respectful of everyone's time. And I did want to quickly wrap up by saying thank you to our expert panelists. Really appreciate your insights, really appreciate your time. I'm sure we'll have many more conversations like this moving forward. But to our audience, I wanted to share that if you're interested in advancing epigenetics of precision medicine in your organization, you're thinking about different initiatives, please feel free to reach out to the Cardiodiagnostics team. We would love to have a conversation, collaborate, think about different opportunities together. And we're happy to share our expertise and discuss strategic partnerships with you. So with that, thank you everyone for joining us today.
Yes, I do want to reiterate, thank you again for everyone on here for your time today. I also want to thank our speakers for an excellent presentation and Cardiodiagnostics for sponsoring today's webinar. To learn more about the content presented today, please check out the resources section on your webinar console and fill out the post-webinar survey. Thank you for joining us again, and we hope you have a wonderful afternoon.